What's up, guys? Thanks for joining here on the webinar. So, especially this time of year is you have folks that they talk about New Year's resolutions, things like that and everything, which are cute. It's a very cute idea, the New Year's resolution sentiment. And I used to do this too. Like I used to say, okay, well, this is going to be a new year. I'm going to do things very, very differently this year, right? I'm going to get up every day at 4 a.m. I'm going to have my workout done. I'm going to have all these things done and make these big changes in my life and everything. More often than not, it really didn't come to fruition. Because consider, unless it's painful enough, unless you see enough meaning behind it, unless you have a why, a real reason to make changes and so forth, you simply don't do it. And one of the reasons why you're here tonight is something that I've said at some point, whether you follow me on Facebook or Instagram or both, or we've met in passing or whatever it is, that this has resonated with you to some degree. And I want you to kind of keep this theme overall in your head, that the foundation of your health, the foundation of everything in your life is built upon your health. And if your health is off, then that foundation is not going to be stable. And really, how can you build a life that matters otherwise? So what I want to show you is my life-changing protocol that is finding health problems before people ever even knew that they had them, and how it can do the same for you. And I'm going to be caffeinated throughout this. Now, I have an incentive for you. If you stay to the end, because I want you to stay. There's some amazing information in here, and I'm so excited to bring it to you. If you stay to the end, I'm going to give you the gene hack list. This is not the actor Gene Hackman. It is the gene hack list, okay? What this is a list. It's a simple list, page or so, of condensed information on what you can start doing today. What you can start doing today to start making you healthier at the cellular level, at the molecular level. And some of the stuff is really, really simple. Some of the stuff is way more complex. The beauty of it is I have everything cited in there. So this isn't just some recommendation of, oh, Dr. Boyd thinks this is a good idea, so it's on there. No, it is cited of where I found all this information. It takes out all the fluff. There's no, like, you don't have to go searching around for all this different info and everything. I've condensed it very, very nicely for you. And that's my gift to you if you just stay to the end of the presentation. It won't take more than an hour of your time, and it's going to be time really, really well spent. It's going to be awesome. Here we go. So why should you listen to me in the first place? First of all, I am a real doctor. I'm a real MD, medical doctor. I'm a real doctor. I'm board certified. I have over a decade of experience. I'm the former director of a major cancer center. I've worked with a lot of cancer patients. I've worked with a lot of sick folks. In the time, I've also had the opportunity to do quite a bit on media, whether that's TV or radio, social media, etc., and an expert authority in those realms and delivering information to folks. This is me doing some of those things, speaking of. And if you've never done anything live media-wise, it's pretty cool. It comes along with, I admit I'm a little bit of an adrenaline junkie, and it certainly comes along with that you get kind of a rush of adrenaline that goes along with it in the process of things. So I enjoy doing live stuff, live work and everything, enjoy doing these live webinars and everything, along with that stuff that you see there. As far as for expert authority, these are some of the folks, some of the famous folks I've had opportunity to rub elbows with and give medical advice to and just share ideas with and so forth. Guy you see here on the left in the blue hat, that's Greg Glassman. Greg Glassman is the guy who started CrossFit, not a CrossFit gym. I mean CrossFit, the whole darn thing. Brilliant guy. Up top you see Bob Bondurant. Bob Bondurant, racing legend, and still holds the record, as to my understanding. He still holds the record for the Le Mans, the only American to win the Le Mans back in the 1960s. Bottom right there you see that handsome devil, Garrett J. White. Garrett J. White is a mentor, a motivational speaker, a men's leader, and had started a Wake Up Warrior. So really, really cool guy there. I had an opportunity to meet all these folks and advise them. So here's some personal stuff I want to share with you. Spend this time just really talking about it. And I don't know if you've ever been in the situation where you ever feel like something's wrong, just something isn't right. So in the process, I'll tell you the background. In the process of developing BLINDSPOT, really where it came from is I had worked for years in the cancer space and kept finding stuff in people. So folks would come in with a maybe a cancer diagnosis, or they already had a cancer diagnosis, then I'd find other things wrong with them. And one day I was sitting down having lunch with a buddy of mine who's a radiologist, and I said, you know what, man, why aren't we just scanning folks looking for things instead of waiting to take care of it once they came about? And he said, you know what, that's a good idea, but the problem is that insurance companies are never going to pay for it. So it's just this is never really going to catch on. And I felt a bit defeated that day, but I kind of always had this idea in the back of my head of wouldn't that be amazing if we could make something like that at some point, right? Anyway, flash forward, years go by and everything, and I had met a gentleman by the name of Jim Stegg, which you're going to, if you haven't seen Jim's case study already, you're going to see some stuff about Jim here in just a little bit. He drops in and has a word here on this webinar as well. But Jim's very vocal with things and very open to stuff on social media and everything. One of the fittest dudes I've ever met. Jim had a heart attack, and it's one thing you think of, like, your typical person that you would picture having a heart attack, like, obese, sedentary, with like a cheeseburger in their hand, and a cigarette in the other. And that is not Jim Stegg at all. And for him to have a heart attack, that was a big deal. So I'm sitting in a Starbucks with Jim, and we had finished his charity event and everything that we were working on. And he had said to me, he's like, man, he's like, is there anything else I can do? This is post-heart attack, after he got a cardiac stent, all that other stuff. He's like, is there anything else I can do to look at my health? And I said, I had this idea, and, I've never put it together. I never pulled the trigger on it. And that's really was the infancy of BLINDSPOT. And he was like, you've got to do this. You've got to bring this to folks. If you would have done this, I probably wouldn't have had my heart attack, right? And I said, yeah, you're right. So that's what kind of the catalyst to get things started. All of that leads up to this for a reason. I wouldn't ask anyone to do anything that I wouldn't be willing to do myself. So BLINDSPOT, how it was created, and it really is created because nothing like this exists anywhere else. And in order to get the testing right, to figure out the settings on the machines, everything, I use myself as the guinea pig and put myself through. This is my brain MRI. This is me that you're looking at. And you can see here, these are the orbits, my eyeballs right there. You can follow the track back. This is the optic nerve, and it's hardwired directly into the brain. And I want you to pay attention to this area right here at the end of the arrow. You can see it, that little white spot. Now, you don't have to be a radiologist. You don't have to be a doctor. You don't have to be anything medical whatsoever, just to be able to look at that white spot and you look at the rest of the brain and say, you know what, that isn't like the rest of the brain. That kind of stands out a little bit, And you're absolutely right. It does. So this made me stop dead in my tracks. I'm sitting there looking at my scans with Dr. Frank Sabatelli. You'll hear more about Dr. Sabatelli later. Amazing radiologist. And he said, have you been hit in the head a lot? And like any head trauma? Were you a boxer for a period of time or something? I said, no. He's like, oh man. He's like, are you having any neurological symptoms? And I thought about it. And this was one of these things where it was like, I kind of kept just putting off and putting off and putting off. And I said, yeah, every once in a while, the left side of my jaw, it'll feel a little bit numb. My left hand will feel a little bit numb. It's only really when I get like really, really stressed out. I checked it up to like, maybe I had too much coffee that day or something, and then it goes away. I was like, it's not a big deal. And sure enough, this is right about that area where that would affect. And this looks like this very well may be early stage multiple sclerosis. Now, the amazing thing with multiple sclerosis, I knew of it, of course, being a doctor, and I've taken care of patients with it, but I'm not a multiple sclerosis expert yet. But the thing about multiple sclerosis is it can progress real quick. And if anything, I spent maybe about a good 2 minutes feeling sorry for myself, that I was like, I'm 42 years old. I'm fit. I'm fitter now at 42 than I was at 22. And here I am with this thing that's there. like, woe is me. For a good solid 2 minutes, I felt that way. And then I said, you know what? All right, it's go time. Because this, if anything, this was a wake-up call to me that I don't have time. I don't have time to wait to do the things that I want. I don't have time to wait to become the dad that I want to be. I don't have time. And this was a real blessing because this changed everything for me. And this is what just kicked me into high gear to move and to make Blind Spot happen. And it's already changing people's lives. So I'm super excited for you to be here tonight. And I want to share a lot of information with you that is going to be really a game changer and can shift your life if you allow it to. And I can tell you firsthand right there that it does. So how do you find major health problems without waiting for them to show up first? Well, let me tell you, there's a series of secrets that our healthcare system has. And I'm gonna disclose those secrets to you. And I have to say, for a while there, for a long time, I was part of the problem, and I didn't even realize it. As a doctor, I didn't even realize I was part of the problem because I was so entrenched in the healthcare system, so entrenched that, this is how we do things, that I didn't even recognize it myself. So here's secret number one. Secret number one is just because your physical and your labs look okay doesn't mean that you are. I can't tell you how many times where folks have come in, they've had a heart attack, they were diagnosed with cancer, and they say to me, Doc, I don't get it, I don't understand. Like, I just had a physical not long ago and checked the labs, my doctor said everything looks good. Why? How could this be? How could this be that I get this diagnosis? Everything clearly isn't good. Well, the reason why, I'll talk about that in a sec. The reason why is that the testing and everything that is typically used, that is conventionally used, it doesn't look for these types of things. It's looking at really basic things. Your blood count, maybe your electrolytes, your kidney function, your cholesterol. It's the same cholesterol testing that we've done since like the early 1970s. That's all it's looking for. It gives us very surface level analysis for you. And it really, really doesn't show that much. It's better than nothing, but if you're talking about being really, really rigorous and really trying to prevent disease, it's simply not enough. The second part of that is the guidelines. Now, medicine operates with a series of guidelines, okay? And that's really what they are. Think of them kind of more like the lanes on the highway. Like these are the painted markers for the lanes on the highway. That's what those guidelines are. You can drift in and out of them, but it's like, okay, at least stay in the lane for this. And here in the United States, we have the USPTF, the United States Preventive Services Task Force. And they basically come up with the guidelines where they tell doctors, okay, this is what you're supposed to do. At least do this. Here's the problem. USPTF, they look at big population statistics, and this is where they come up with the guidelines. Now, if you remember a couple years ago, there was this big debate on mammograms. And there was, draw your attention to this word right here, biennial. So a couple of years ago, USPTF came out and said, you know what? Women they really only need to get a mammogram every 2 years, not every 1 year. And most doctors stopped in their tracks and said, what? Like, what are you talking about? We're talking about this age range, 50 to 74. This is where you see the majority of breast cancers. Yet you're saying instead of doing it every 1 year, do a mammogram every 2? Are you kidding me? So what this caused now is a problem. It caused a bunch of confusion. You have doctors that were doing it every 1 year, and most patients that were following what their doctors were saying. Now you have news and the USPTF is coming out and saying, no, we're making the guidelines every 2 years. So now you have two different bits of advice. And on top of it, if you're a lady that's watching this that's ever had a mammogram, it's not the most pleasant experience. The breast is basically squashed between two plates in both directions, and then films are taken. So there's a lot of times that women are basically looking, not all, but some look for an excuse not to have this unpleasant testing done in the first place. Well, now we've just given them a reason. Now we've just given them a reason in the medical world to say, well, so these people are saying do it every 1 year. These people are saying do it every 2 years. And here we are. It caused mass confusion. The second thing is, look at this here. And this is taken from the USPTF website. Recommends against teaching self-breast exams. Are you kidding me? Now listen, I'm a good doctor. I've done a lot of breast exams throughout my career. But regardless, I'm never going to know someone's breast better than they are themselves. That's what this is saying. The whole rationale was simply that, you know what, women are going to find things in their breast, and those things may not be anything. Yes, that's exactly right. However, those things may be something. And that's the point of doing the exam in the first place, is to catch those things. But wait, there's more. Let's talk about gentlemen, prostate cancer. So prostate cancer, this is a confusing slide. I'm going to break it down very easily. Essentially up here, what they're saying is they're saying of 1,000 men that get screened for PSA, only one is going to avoid death from prostate cancer. Therefore, don't bother doing PSA testing. There's a couple problems with this. Number one, if you're this man, if you're that one guy, that's a big deal to you. If you're diagnosed with cancer, no matter how rare the cancer is or how common it is, you are 100% being diagnosed. So when you talk about these big population statistics and everything, you know, it's one thing when you're just looking at numbers on a graph. It is completely different when you're talking about an actual individual. What about actually taking care of people? This infuriates me. And one of the things is that, you know, like I said, I've been a doc now for 10 years. Physicians that are coming out of training now are being taught this, are being taught, don't bother checking with a PSA. Now, truth be told, PSA is not that great of a test. Prostate-specific antigen, it goes up and down. The level in the blood goes up and down. It's not that good of a test. It's only right about 40% of the time. So it'll rule in a diagnosis. It won't necessarily rule out a diagnosis. Okay? But do you know how many men that I've checked with PSA that have turned out to have prostate cancer? Hundreds. Hundreds. So if that's hundreds of men that I checked that were that one, then really, how common is this? It's infuriating. It's absolutely infuriating. So PSA testing, I recommend it. Gentlemen, whether you go through BLINDSPOT or not, talk to your doctor about PSA testing. I think it's a good idea. In the right patient. You have to meet the right age group and so forth. So USPTF, it gives a bunch of mixed advice, in my opinion. And it comes down to this, a bell-shaped curve. This is basic statistics. Oh, I knew when I studied this in college, statistics would come back to get me one day. And here it is. So simple bell-shaped curve is what this is. And basically what it says, to break it down, is that, you know what, these folks here in the center of the curve, the main portion of the curve, the 68.3% of folks probably won't be affected. So it probably won't be affected when we're talking about all these cancers. Majority of folks are going to be fine, 68.3%. But what about the folks here on the positive side of the curve from here on that are? That's a big deal. What if you or one of your loved ones falls into this group? Let's talk about those. Because as it stands right now, those are where the guidelines stand. And it basically is largely left to chance. Secret number 2, numero dos. The healthcare system profits by you being sick. You've always kind of suspected it, right? You're correct. I'll prove it to you. This here, what you see, this confusing looking thing, is basically how physicians bill. And this is based off of CMS, based off of Medicare. And Medicare is kind of like the most basic of all the insurances. All the other insurers and everything base everything off Medicare. So you can kind of see how things go and the steps with it. And I have it broken down very, very simply, 1, 2, 3. So let's go through it. So you have it underlined there in the first one. So this is the code for a general physical exam. And this code, ICD-10, the ICD-10 code is what gets billed for it. Sidebar, there are codes for everything when it comes to ICD-10 codes, okay? Everything. Sometimes for fun, because I'm a nerd, I'll go and I'll try to look up the craziest possible code that I could. I think the craziest one that I found was a shark bite with retained tooth in the thigh. They have it. It's that specific on all these things. So this is just a very simple, basic code for a general physical exam. But you take this code, now you apply it to the box I have labeled number 2. So you've had it so that your doctor sits and asks a history. Hey, what happened during all this? Let me do a physical exam, so forth and so on. And that's so that it comes down here, and these are billing codes. These billing codes, 1 through 5, are the associated billing codes with it. So now they've gone. They said, this is what the person is there for. They've gathered the data behind it. Let's apply that data to what's that charge going to look like. So if you come over here, let's say it's an established office patient, and they come over here with a level 4 99214 code. You come over to that and say that it's a, we'll be conservative and say that it's just a regular office visit, $93. So that's what's being reimbursed, is $93 to your doctor for seeing you for this problem. Here's the thing. Most doctors today are owned. It's not, most doctors work for someone else. So they work for like a big company or a big hospital system or something like that. And just like any industry, there's pressure to hit a number. There's pressure to be as productive as possible. And so on average, most folks will see their doctor for 7 minutes, if that. If they're not seeing, a physician assistant or nurse practitioner, if they're seeing their doctor, it's 7 minutes is what they'll get. Now, let me ask you, how preventative can you truly be in 7 minutes? I'll tell you right now, not very. So there's no incentive for physicians. There's no incentive to take the time for you to find problems with you early. There's only incentive to deal with the problems that are already there and give you yet another pill. Which leads to this, big pharma. Now, I'm not saying pharmaceutical companies are all bad. That's not what I'm saying. As a matter of fact, there was a pharmaceutical company here just a couple weeks ago at the time of this webinar that came out with a vaccine for Ebola. If you don't know about Ebola, Google it. It's pretty amazing. It's a virus that basically liquefies people's internal organs. It's only in Republic of Congo, Democratic Republic of Congo, and it's really affecting folks. And so, that's not a big market. It's a very small market, right? But they developed this vaccine and it'll save many, many lives. But there's the other side of pharmaceutical companies. Like, for example, here, this is a tongue-in-cheek cartoon about it, but it talks about opioids and folks being addicted to the opioids, and pharmaceutical companies are the cause of that to begin with, because misinformation was given to doctors when that was all started, when it was prescribed and all. And now you have folks that are addicted to medications. You also have folks that when they come up with when a medical diagnosis comes about, it's like, here, just take another pill, take another pill, take another pill. For how long? For the rest of your life. Just keep taking another pill. Because the reality of the situation is there's not money in people being healthy. There's not money in people being dead. But when people are sick, when they're sick, well, then now you have a consumer. You have a healthcare consumer. You have folks that are going to hospitals on the regular, that are getting medications on the regular, that are going to their doctor on the regular, but just kind of to keep going, to keep taking another step, to keep rolling forward. And that's the unfortunate truth of the system that we currently live in, which leads me to these guys. I have no love in my heart for medical insurance companies, none whatsoever. I'll tell you a story. When I worked in the cancer realm, when I was working at the cancer center, one of the things that I did quite a bit was argue with medical directors of insurance companies. Medical directors are a doctor, it's a physician that has been hired by an insurance company to argue with the doctor on the other end of the phone of why that person doesn't need a certain test. I have zero respect. I have no respect whatsoever for doctors that sell their soul to these insurance companies and go work for them in order to try to shoot people down. Zero respect. There's a hot place in hell for those doctors. And I would argue with these folks till I was blue in the face of a reason why a patient would need a CT scan, of a reason why they would need a PET CT, that they were diagnosed with with a cancer, and we needed to look to see if there was any metastatic disease anywhere. And so that they needed a PET CT. A PET CT is a really fancy test. It's very expensive, usually runs around $8,000. But it can very often show, once you know somebody already has cancer, you can do a PET CT to see if there's any bits of cancer anywhere else. And so it can help with staging and treatment and so forth and so on. Do you know how many patients that, no matter how much I argued with those medical directors and insurance companies, didn't end up getting the test? The reality is, folks, is that insurance companies dictate so much of your healthcare, you have no idea. They dictate based on how much they're willing to spend or not spend, and it's usually not. They're happy to take money out of your check every month. And then when it comes time that you need to actually go and use that money for something, for a health problem, you get denied. That's why they are as profitable as they are. It is the biggest scam that there is. It's the biggest legal scam that there is. This is legal for them to do this. So I have no love whatsoever for medical insurance companies. And what I would challenge you is to look at your last pay stub. Look to see how much you're paying per month. It's in the hundreds. Minimum, it's in the hundreds of dollars. It's being taken out of your paycheck. You don't even know it. And then ask yourself, what am I getting for this? I'll give you a hint. It's not much. Here's secret number 3. It's on you. That's the reality. The reality is our health is our responsibility. We look to our doctor. We look to our insurance companies. We look everywhere else except pointing the finger at us to say, you know what? My health is my responsibility. And I love this quote by Dwayne Johnson here. No one's coming to save you. Life is 100% your responsibility. And it's absolutely true. It's absolutely true. So far, this is what we've learned. So far, the current system doesn't prevent. The current system profits by you being sick, and you are responsible for your own health. The problem is there really was no alternative until now. Now, let me ask you a question. Up until now, I have been, up until now, I've been giving you a lot of information, okay? And so with that information, you may feel like this guy, or you feel like you're drinking from the water hose, right? If I may, I'd like to tell you about BlindSpot and how BlindSpot is giving you the opportunity that you can then put the power in your own hands and actually do something that you can't do anywhere else, and really have the most aggressive prevention that there is. Is that okay with you? Is that all right with you if I share this with you? Because I'm super excited. BlindSpot is my passion project. It is my solution to all of these problems that we just discussed. So if you're cool with it, I'd like to just say yes, or you can raise your hand, you can yell out loud, whatever it is you want to do. But I'd like to show you what BlindSpot is all about. Is that okay with you? Okay. Oh, thank you. Okay. All right, good. All right, let's go. So let me start by showing you a little bit about this guy, Jim Stink.
BlindSpot Medical gave me the opportunity of an education of the inside of my body, gave me a peace of mind that I know exactly what's going on inside my body right now. I had an architectural rendering of my brain, my heart, my lungs, my spine, my stomach. I looked and I saw everything that was going on inside my body. You can take steps to fix any issue that you will see on that computer during those tests. You can navigate around that and you can save your life. Those things that you do not know about the inside of your body can kill you.
Absolutely right. Absolutely right. All right, Jim, thank you for your endorsement there, sir. So let me tell you what you get. Let me tell you what you're going to get with BlindSpot. First of all, we begin with a complete laboratory analysis. This is a $2,864 value. So what we do, this is not your conventional labs. We look at subparticles. We do subparticle testing. And consider this. If you look here over the heart and all the vessels and everything, see some pretty small vessels that are there. The smaller the vessel, the more places that these particles can cram themselves. So we do complete subparticle testing, looking for all the little fat deposits, anything that can cause inflammation and actually increase risk of cardiovascular disease. Of course, you also look at tumor markers. So nobody looks at tumor markers. You look at tumor markers for the conventional and most common cancers that there are, including ovarian cancer if it's women, colon cancer for men, of course, prostate cancer we talked about as well. Also look at kidney function, liver function, all of the electrolytes. Go into an in-depth analysis, evaluating all of these to make sure that we find any problem before it becomes a big one. So the second part of this is a VIP lab draw. So you're not waiting in some waiting room or anything like that. For folks that live here, we're based out of Phoenix, Arizona. For folks that live here in Phoenix, this can be done at your home or at your office. If you live outside of Phoenix, you travel here to beautiful Phoenix, Arizona, and then right there in your hotel, labs are drawn. You don't have to go anywhere else. We have the results in about 24 hours. Second thing you get is complete physical exams. A complete physical exam that's completed by myself along with Skin IO. Skin IO is really amazing. So as it stands as of a couple weeks ago, I was the only, and I think I still am, the only provider in the state of Arizona that has Skin IO. Really amazing. So what this is a dermatoscope that is hooked up to an Apple device, and we basically take pictures of all the little moles that you may have on your body. That information is then uploaded via HIPAA secure, it's completely secure. It's uploaded into the cloud with Skin IO, and their artificial intelligence analyzes all of the moles that are there. And what the amazing thing is it's being cross-referenced against all these other millions of people's moles as well, which means it's not just an opinion by a dermatologist or anything like that. It's actually looking at all of the little comparisons, millions and millions of moles that are all being compared. And if there's a problem, it then alerts and says, you know what, this is something that either needs to be watched or it needs to be biopsied. You see here in the upper right-hand corner, this guy taking a picture of his mole with his phone. Really cool thing is, let's say we find something that it's like, we really need to take a look at this. Let's reevaluate it in 3 months. And you live all the way in Michigan. Then I send you a link. You take a picture of it in 3 months with your phone. It uploads. It goes ahead and it goes through artificial intelligence, looks to see if there's any issues, and can render the opinion. Really, really cool. Absolutely amazing. Where we're at with our technology to be able to offer something like this, and I'm super excited about it. It's going to save a lot of folks from skin cancers and such. So go over this again. What you're going to get: complete lab analysis, $2,864 value. Complete physical exam with Skin IO, that's a $1,197 value. It's a total value of $4,061. What else? Brain MRI. Brain MRI with expert interpretation. So you saw my brain MRI, this is an example of an MRI machine similar to what our blind spot patients go through. And this is the stuff that we're looking for. So here on the left, you see a brain tumor, see brain aneurysm there in the upper right. And then that's my MRI there in the bottom right, demyelinating disease. So intentionally to find these things when they're small before they ever become big in the first place. So brain MRI is here on the list as well. So taking from the top, complete lab analysis, $2,864 value. Complete physical exam with Skin IO, it's a $1,197 value. Brain MRI with expert interpretations, $4,997 value, total value of $9,058. Next thing is a low dose chest CT with expert interpretation. This is a $1,447 value. There you have buddy Jim there going through when he was getting his CT. That's not a picture of his CT there. That's an example. But this is amazing. You do this low dose, try to use as little radiation as possible while still getting really high quality images. And this is the stuff that we're looking for. We're looking for things like lung cancers that you can catch early. And anyone who's ever known anyone with lung cancer, you want to try to catch it as early as possible. It makes a massive difference when you catch cancer early versus not. So What are you going to get? Complete lab analysis, $2,864 value. Complete physical exam with skin IO, $1,197 value. Brain MRI with expert interpretation, $4,997 value. And low-dose chest CT with expert interpretation, $1,447 value, for a total value of $10,505. But wait, you're going to get more. CT, abdomen and pelvis with oral and IV contrast with expert interpretation. This is a $3,554 value. What we're looking for obvious colon cancers. Now, when I say obvious, colon cancer, to see it on a CT scan, it's got to be pretty big for it to be there. It's got to be sizable enough. The addition, when you're talking about colon cancer, okay, first of all, of course, we'll always talk about family history and everything, and that may up the ante a bit if there's family history thereof. The other thing that I usually recommend, depending on the age of the patient and family history and so forth, is sometimes I also recommend folks use Cologuard, and that's a separate conversation that we have. But Cologuard is a genetic test where a small bit of stool is taken on a swab and sent off to see if there's any genetic markers actually in the stool itself for a colon cancer that could potentially be there. When you start layering things, like with imaging and other testing modalities and everything, you have a higher chance of certainty of finding things. Other things that we look for, of course, are liver lesions, any kind of anatomical defects or anything that could cause a potential problem. So what are you going to get? Complete lab analysis, $2,864 value. Complete physical exam with skin IO, it's a $1,197 value. Brain MRI with expert interpretation, $4,997 value. A low-dose chest CT with expert interpretation, $1,447 value. CT of the abdomen and pelvis with oral and IV contrast with expert interpretation, $3,554 value. It's a total value, $14,059. But there's more. So CT, coronary CT with architectural rendering of the heart. And so here you see in the bottom left-hand corner of the screen, this is a three-dimensional image of the heart. Really, really cool, because you actually can see the back side of the heart as well, which you usually don't get to that visualized. The whole point of this is to try to find, of course, structural problems, to look to see if there's any problem with any of the coronary arteries or anything like that, and to find these problems early on. It very well may have been that, Jim Stegg, the gentleman that you saw, if he would have had this test prior, likely would have had a heart attack to begin with. Value, $497 value. So, complete lab analysis, $2,864 value. Complete physical exam with skin IO, $1,197 value. Brain MRI with expert interpretation, that's a $4,997 value. Low dose chest CT with expert interpretation, $1,447 value. CT of the abdomen and pelvis with oral IV contrast with expert interpretation, $3,554 value. And coronary CT with architectural rendering of the heart, $497 value. It's a total value of $14,556 that you cannot get anywhere else. And additionally, there is no way that companies or anything pay for this. This is something that that it's up to you to make a big impact in your health. Next thing is body tour with myself and Dr. Frank Sabatelli. Now, outside of the medical world, you may not know who Frank Sabatelli is. Dr. Sabatelli is a absolutely amazing physician. He's an interventional radiologist. He's absolutely brilliant. Interventional radiologist, this is a specialty within radiology where if there's something, a procedure, like a micro procedure to be done, for example, if someone has like an aneurysm in the brain that has the potential to burst, Dr. Sabatelli would be the guy that would go in and coil it off before it ever becomes a problem, like diffusing a bomb inside of someone. Same thing with different tumors, with all kind of vascular problems and so forth. If it's a complicated biopsy in the lung or something like that, you have to figure out how to get to. This is the man that does it, and he's absolutely brilliant, and that's the reason why he is the director of radiology for BLINDSPOT Medical. This is me sitting down with my body tour with Dr. Sabatelli, and those are my films that you see there on the screen. I wasn't expecting how amazing of an experience this to be. I've seen thousands of CTs and MRIs and everything throughout my career, but it is so totally different when it's you and you're looking at the inside of your body and you get to know yourself on a level that is unfathomable, to actually see the inside of yourself, your inner workings, and address any issues that are there. It blew me away. It was one of the most amazing experiences of my life. And I'd love for it to be the same for you. It's unique, it's amazing. And like I said, it's personal. It's as personal as you could get. It's your inside. This is a $2,569 value. So what you're gonna get: complete lab analysis, $2,864 value. Complete physical exam with Skin IO, $1,197 value. Brain MRI with expert interpretation, $4,997 value. Low-dose CT with expert interpretation, $1,447 value. CT of the abdomen and pelvis with oral IV contrast and expert interpretation, $3,554 value. Coronary CT with architectural rendering of the heart, $497 value. And body tour with Doctors Boyd, that's me, and Sabatelli, $2,569 value. Which, have you ever had the opportunity to sit down with two doctors and talk about your body and everything that's going on? I'm going to go with probably no. Final thing, targeted action plan. So what this is we take all the information. So I take all the information from your labs, all of your family history, all of your personal history and habits and things that you've done throughout your life, and then all of the imaging and the findings that we have, and we construct it all together and make a targeted plan so that you know exactly what you need to do. So that there's no questions, there's no, well, maybe I should try this or maybe I should try that. You have a targeted action plan. These are the steps that you need to take. I wish someone would have been able to do this for me. This is absolutely amazing. This gives folks the opportunity. They have the power in their hands. They have all the information and everything is right there. It's absolutely amazing. Value $5,977. So complete lab analysis, $2,864. Complete physical exam with Skin IO, $1,197. Brain MRI with expert interpretation, it's a $4,997 value. Low-dose chest CT with expert interpretation, it's $1,447 value. CT of the abdomen and pelvis with oral and IV contrast with expert interpretation, $3,554. Coronary CT with architectural rendering of the hearts at $497 value. Body tour with Doctors Boyd and Sabatelli, $2,569. And a targeted action plan, $5,977. Total value of $23,102. $23,102. So let me ask you this. If all this did was give you a peace of mind, would it be worth it? If all this did is give you an action plan to finally get your mental and physical health on track, would it be worth it? If all this did was give you the ability to plan your life based on the facts that you would discover, would it be worth it? You can see where this is worth $23,102 easily. You can get started today for $4,997. Massive savings, massively what you get. The real question becomes, is it worth investing your time and money to ensure that you are here for years to come? Do you want to do everything that you can to live as long as you can at the highest standard possible? What blows me away is folks are more likely, they're more apt to spend money on a car than they are to actually invest in their health. Not thinking that, you know what, if something happens to me, I'm not going to be able to drive that car in the first place. So you may say, okay, well, all right, doc. I mean, I see the value, but $4,997, that's, I don't have that money just laying around. No problem. So I'll give you some options that you can handle. PayPal is one of those options. This is no payments, no interest for 6 months, and you apply for PayPal credit. You get the $5,000, you apply it to BLINDSPOT, and there you go. Additionally, you can also use your HSA. Most folks have health savings accounts nowadays. You can apply your HSA to it as well. It's another option for you that you can use. And so this here is it's over the course of the next 30 minutes is what this offer is good for. And so consider that accordingly. We're already down to 29 minutes and 44 seconds. So this is a $23,000 value. Again, you can get started today for $4,997. You just make a deposit. You make a deposit, put $500 down. I'm going to go ahead and give you the link that you can do that so that you can make your reservation here in just a moment. Before I do that, I want to address a couple questions. So first of all, how often does blind spot protocol need to be completed? And the answer is about 5 years. And the reason why I say about 5 years is because this isn't following a conventional guideline. This is not checking a box. This is something that is completely unique. So in sitting down with Dr. Sabatelli, we talked about it and said, okay, well, about how often would something like this be checked? And about every 5 years is approximately when it would be done. Is it safe? Yes, it is safe. I've gone through it myself. I put myself through blind spot, and so that we can get the dosing of the radiation correct with as minimal possible dosing as possible, but by getting the highest quality images with that lower dose. That being said, it's still absorbing radiation. And it's still absorbing more radiation than you would in an X-ray or going and standing outside in the sun, or if you're a flight attendant that's up flying in airplanes because they're closer to the sun, they absorb more radiation. So all of those things. So yes, you will absorb more radiation, but you also have to look at on the other side of what can you potentially find and take care of, and you look at the balance that's there. So yes, it is safe. I really want to do this, but cost is a factor. Like I said before, PayPal offers that option that you can go and apply with PayPal credit. You can use your HSA, which is the next thing. Can I use my HSA? Yes, absolutely. You can use your health savings account. This is a medical service, so you can use it for that. But the other thing I want you to consider is this. If you stop and you look at your life and you look at how important your life is, we're talking about your relationships, your loved ones, your business, whatever industry that you're in, your ability to go and make money and so forth, your ability to go on vacation and enjoy things, all of those things. Your health is the foundation of all of that. Consider the last time you twisted your ankle, or you had a bad cold, or you had the flu, and you couldn't go and do the things that you wanted to do because of that. Imagine if that's what your life looked like, if that's all your life was, is that downtime that you had. Because that's the reality. The reality is time is really, really short. The reality is we have a medical system that has no interest in making sure that you have a high quality life, and that falls on you. Now, blind spot is not a crystal ball. It's not gonna, it can't tell you what the future holds, but it's darn close. And if anything, it can potentially lead to the one thing that you can't get more of, and that's time. So when you look at it that way, you stop and you look at yourself as an investment. You say, you know what, I'm the investment here. The car, the clothes, the house, all those other things, those are things, but I'm the investment. And I want to be here for myself and for my family. That's when I pose the question to you, how could you not afford to do this? Down in 26 minutes now. So I'm going to give you a code here. Last thing I'll say is, where's it located? It's located in beautiful Phoenix, Arizona. It's absolutely gorgeous. So you don't live here in Phoenix. Then what I would say for folks that live here in Phoenix, this is it's a complete VIP service. Send the lab technician to your house, draw the blood. I pick you up, take you to the imaging appointment, hold your hand throughout the process. It's very personal, the entire process. I'm with you when we go through all of your imaging and so forth, and then deliver all of those results to you right then. For folks that don't live in Phoenix, then you get to, you come and you travel to Phoenix, Arizona. We give you recommendations on places to stay and so forth. We work with your schedule. You are responsible for your travel, but once you get here, then we take fantastic care of you, and would be honored to do so.